Dear colleagues, I will talk about intraoperative blue reflectance as a new imaging modality which might enhance our comprehension behind the pathologic structures that we need to treat. So it's not a science fiction, it's something that it's already mentioned in the literature based on the available SLO devices like the Optus and Heidelberg machines, where the blue light reflectance based on the reflectivity of the superficial capillary layer of the retina is used to evaluate perfusion or non-perfusion areas. And during one of our cases where we have as you might see at the moment, we have a occlusive disease, vascular occlusive disease in the lower part of the retina. We notice that using only the blue light, which we normally use for fluorescein angio, can show us, in combination with the digital filter, actually the areas where there is no perfusion. Of course, we asked ourselves, is it true what we are seeing? So we need to validate it with intraoperative fluorescein angiography. And fortunately for us, it came out that there is almost 100% agreement between both imaging modalities. So where is the advantage of the blue light reflectance? If we don't want to use fluorescein intravenously, or if the patient is highly allergic, we still might be able to evaluate and treat the areas of non-perfusion. Otherwise, in other vascular cases, for example, diabetic cases, I must admit that it's not any time possible to achieve really nice visualization of the non-perfused areas. So having both imaging modalities, fluorescein angio and blue light reflectance, available in our visualization system might enhance our armamentarium against these diseases. So here you can see clearly where there is no perfusion, where there is leakage, and the areas that we might need to laser. Now you see blue reflectance, and even with the blue reflectance we might see better the border between the perfused retina and the non-perfused one. Here I'm doing spot lasering to delineate what I'm seeing with the blue light reflectance, and then I will switch again to fluorescein angio to see if this is the same. The beauty is that we already have the blue excitation light source, so we can switch between both modalities, however we find useful. Here you see perfectly well where there are no capillaries and there is no perfusion, so it can be used again as a selective procedure, guidance of our endolaser, so we are really precise. Here we switch to the fluorescein angio mode and we see again fairly similar appearance of the areas that we need to treat. Again, the blue reflectance, so it's a matter actually of digital filters. The light is the same for both methodologies, but having the ability with the ingenuity to create custom digital filters, you can use blue light reflectance, and also you can use the fluorescein angio. And this is another example where, as you can see, the fundus looks more or less normal. It's epiretinal membrane case. And now this is what we see during the fluorescein angio, and we see a patchy appearance of the RPE, or the choroid, definitely is behind the retina, and we see hyper-reflective structure around the optic nerve. Here, this is the intraoperative fluorescein angio, but in a moment you will see what we might visualize with the blue reflectance. here I'm trying to show with the vitreotome where is the area of interest. Here it is, something really hyper reflective. And here, blue reflectance. So apart from non-perfused areas, it seems that it's possible to see inflammatory areas, because here, again, this is the normal fundus view, and we don't suspect that anything is behind this. Behind it, we later on found that there is a tuberculosis antibodies. So what you need 480 nanometers optical filter, which you might put in your constellation illumination module, and you need an Ingenuity factor-based digital filter in your Ingenuity system. Thank you.